Infertility is an estimated 7.5 million women who struggle with it, and it was recently brought to headlines by former ESPN anchor Sarah Walsh. If you don't know this story, the 39-year-old revealed how she suffered 3 miscarriages before having twins through IVF, in vitro fertilization. Now, one of those miscarriages happening while she was on live television, if you can even imagine. She shared how scared she was to even tell anyone that she was pregnant once she found out, for fear that the IVF wouldn't work. But as she shared, it did eventually work, and for her, as it has for many other women. Joining us now to discuss, we welcome our medical contributor, Dr. Ali Kasraeian. Thank you so much for being here.
Thank you for having me.
This story really struck a chord with me. I mean, I've been so open about it, written about it, talked about it on the show that, you know, I suffered infertility issues, went through IVF several rounds, had 2 successful.
Congratulations.
Yeah, it is a congratulations to like the doctors. I mean, it's a huge, huge process. And so many women my age, it seems like, suffer from infertility. So let's just start right off. Do we know what the causes are?
Well, there's so many. So people talk about this, and it seems to be a discussion that seems to feature female aspects of things. But a third of the time, 30% is a female aspect. 30% of the time is a male factor infertility. 20% of the time is a couple, male and female factor infertility. And the rest of the time, we just don't know. People have recurrent miscarriages that we can't find any issue or any reason for. The woman is completely okay, the man is completely okay, the genetics seem to be okay, and we just don't know why. And that's incredibly frustrating. 1/3 of the time, just nature takes its course, where people have miscarriages that just genetically the baby was not okay, and people don't even know. You know, there are 1 million miscarriages every year that people don't even know about. You know, or they may know about. So nature works in amazing ways that we may or may not understand, and this is a problem that can be very, very difficult for people to deal with. Fortunately, science is moving in directions that allows success stories like you have experienced, and allows conversations, fortunately, to move in directions where we can have the conversation we're having today in a scientific arena that is constantly moving to do better and better, to have success rates that now are exceeding 50% with cycles through people well above their 30s.
That's exciting because I know for so long women felt like they didn't have options, but now they do have options. So for somebody who is not familiar with the IVF procedure, explain to us exactly.
So in vitro fertilization is the idea of taking the natural process of bringing the egg and the sperm together in such a way to optimize the possibility of creating a birth in a process where that has not successfully come to fruition. So basically what you're doing is, for whatever the reason, again, IVF or in vitro fertilization is not the first thing that someone goes to when they go through the process of not being able to have a successful pregnancy. And again, what constitutes infertility is someone tries to have a pregnancy, and what's thought of as infertility is when you try for a year of unprotected intercourse and you're not able to get pregnant. That's one factor of this. When you talk about in vitro fertilization, a lot of people get pregnant and they're not able to carry the pregnancy to term. So there are multiple factors and multiple reasons for this. So this is not always the first aspect. Artificial insemination, where you actually implant the embryo, which is the fertilized egg and the sperm come together, you implant that into the uterus. That's not this. This is actually where you take the sperm and the egg, bring them together outside of the body, and then you implant the process. So this is basically a 5-factor process. You take medications, so the woman takes medications, and that tries to get a lot of eggs produced by the ovary. Then you go through a process which it's kind of like an ultrasound, transvaginal ultrasound. You get as many eggs as you possibly can. That sometimes is an easy, or for some women, not so easy for other women, process with the medications. You get all the eggs. At the same time, the male delivers the sperm. For some men, it's an easier process from an ego standpoint to go through that process. And then at that point, the fertilization process begins. And usually most fertility specialists have an embryologist who is usually very, very skilled at trying to bring together the best situation for fertilization. Nowadays, there's actually technology that can allow, after a few days where the fertilization occurs, to look at and find the best embryos to give the best chance for the process. So you can actually do genetic testing. You can actually biopsy the embryo, send, yeah, you can send.
They grade your eggs, basically, is what they do.
Oh my gosh. So Dr.
Cool.
Ali, what is the success rate of IVF?
So if you kind of look, you know, they're better than 50%. You know,
wow.
when you look at and it's all over the place. You can Google this and get all sorts of statistics, but they're raised better than.
I'm asking for a friend, definitely not for me.
Yeah, no, but if you look at it, you know, if you look at the CDC, they talk about 40%. Some studies they look at 50%. If you look at they can break down the best in the country. Some exceed 70%. Oh, nice. But if you look at some places, it's about 50% or higher for people younger than 35. As you kind of increase in age, younger than 35 is about 55% or higher. As you kind of get above 35 to 37 is in the 40s. As you kind of get above 38 to 40 years, it kind of goes down. Above 40, it becomes a little bit more difficult. But again, the technology is becoming better, and it really depends on a couple factors in terms of the quality of the egg, the genetics of the egg, and then how the process of getting the perfect egg, the perfect scenario, and a lot of it is kind of the luck of the process.
Now, speaking of technology, these 3D ovaries that was used on mice, please let's talk about that.
Okay, so when you look at this process that we're talking about, bringing the egg together, bringing the sperm together in this process, one of the big factors for this is the egg. So some processes, the ability to have an egg is affected. So think about a young child who has cancer, and they go through chemotherapy, and even before they get to puberty, the egg may be affected by the chemotherapeutic agents. Or people that have ovarian disorders where the process of the egg being able to be, or the ovary being able to deliver the egg is impacted. So that's a very heart-wrenching process, and a heart-wrenching disease process where the treatment that is going to save your life may impact a very, very warm and very, very important part of most women's life. So the technology here with 3D printing, everyone's kind of like, well, how do you just push a printer and it creates an ovary? It's a little bit more elegant, a little bit more complex than that. What this technology is basically you create a scaffold. So everyone kind of thinks of this in terms of you're creating a building or thinking that. Here they basically use a matrix to create essentially the ovary, and then you put in the follicles, which are going to create where the egg can potentially mature over time. And in this study with the mice, what they did is they took mice and took the ovaries out, then put this created 3D printed ovary, and then they kind of created the perfect scenario for this created ovary to mature and begin to create eggs in this synthesized ovary, and they were able to mature eggs that were able to get fertilized and be able to have babies.
Wow.
That's crazy.
That's impressive.
Oh
my gosh.
And this is beginning to kind of move into this idea where could we begin to synthesize organs that can allow us to create a whole new world of transplantation of organs where they can be specific to us. And you hear about this in terms of self-transplantation or auto-transplantation, because then you can transplant organs without needing immune medications. And this is a very, very exciting field. And here specifically, it opens the door to fertility where the hope did not exist before, for people where the beginnings of their life may have had a big issue to affect their ovaries, where it could have had a big strike against them in terms of their future fertility. And that's where this technology may have profound positive implications. And again, our science is moving in directions which is just so exciting. And to see something like this come up is just absolutely amazing.
Before we wrap up, we want to talk about a new campaign. Unfortunately, the loss of lives in Manchester recently. So there was a campaign, Stop the Bleed campaign. So talk to us about that.
So the Stop the Bleed campaign, unfortunately, is not that new, but it's an amazing thing that the American College of Surgeons has been doing over the recent past to help all of us, not just surgeons, not just EMS, not just people who are trained in dealing with trauma, to be able to stop the bleed. The idea with this came from the fact that if something tragic was going to happen, people lost lives because from the moment something happened to the time that they got to the hospital, people were just bleeding to death at that scene. So you can imagine in Orlando at Pulse, in Manchester at that scene, anywhere that something may happen, Boston. You can imagine that when at that moment, if someone had an injury to big vessels, limbs, where the point of injury that happened, that major vessels would be transected. If you bleed, if you could do something that you can see on the screen here to stop the bleed, you could potentially stop a major amount of blood loss that could get them to the hospital, and it could potentially save their lives. So the Stop the Bleed campaign is to teach everyday people to intervene, and by acting, by seeing something, doing something, you could save a life. And the idea with this is to make all of us not just bystanders, but people that can be active members of a community that could potentially do something to save a life. And these are things that you can go to this Stop the Bleed, anything, you can Google it, you can go to bleedingcontrol.org, you can go to the American College of Surgeons website, and you can Google all this stuff. It's all over the place. And locally here, we have a Jacksonville chapter of the American College of Surgeons. There's a Florida chapter of the American College of Surgeons. And there are a lot of things going on in Jacksonville and the state and in the country that are constantly educating us on how to do these things. And I'll try to be very proactive on letting us know on this show and on my radio show of when events like this are going on, so that we can learn about how to be proactive. Because unfortunately, we talk about things like this happening in places that we never knew things like this would happen, and children and everyday people have to learn how to do these things, so that we cannot be victims by people that really don't care about people that shouldn't be victims. And so this can potentially save lives, and it's a very simple thing to do.
Never thought really that we would have to teach, you know, each other and.
But they're simple, but they're really simple things to do, and I think they'll be proactive as opposed to retroactive, or to allow us to be victims when we don't have to be. This is an amazing thing to do, and it's an amazing program by the American College of Surgeons. So let's be proactive to not allow us to be victims.
Thank you so much, Dr. Kasraeian, on both conversations, because I also think the infertility.
And congratulations. I'm glad you're doing well. And again, for people that one thing that just, sorry to Bonnie for doing this, but be proactive about your fertility, because this is one thing that's very important to people, and make it a choice that is your choice. Don't make sure that it's not something that someone tells you to be your choice. So whatever your choice.
And don't wait for the guy. Go harvest eggs.
And that's a big thing. That's a big movement that's happening across the country for people that at younger ages. If you want to push your fertility out because you want to go to school and you want to be smart and you want to do whatever you want to do, make sure that you take control of your fertility, because things in vitro fertilization allow for you to do that. But make sure your fertility is your choice, whether you're a man or you're a woman.
I agree. Thank you, as always, for being here. This medical contribution was furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation. It's great. Saturdays on WOKV from 5 until 6. All right, well, coming up next, a local woman joins us to discuss the sex trafficking issue we have right here in Jacksonville and how our community can help. Stay with us.
Next, New Ellen, Kelly Mandel.